On the streets of our cities, there are many people still disregarding the COVID-19 safety protocols, especially the wearing of face masks and social distancing, contrary to the president's directive. Persons violating the protocols risk fines up to 60,000 Ghana cedis simply for refusing or failing to wear the mask in public places. A jail term of up to 10 years also awaits such persons if they cannot pay the hefty fines. Last night, President Akufo-Addo announced a step-up in enforcement as cases begin to rise at a rather fast rate.
14 persons are said to have died from COVID-19 in the last 2 weeks alone. President Akufo-Addo says the country's situation is worsening by the day.
2 weeks ago, there was no critical case. We now have 33 in our treatment facilities. At this current rate, whereby 13 out of the 16 regions have recorded active cases, our health infrastructure will be overwhelmed if the situation continues. It will severely undermine the efforts government is making to revitalize the economy and put our nation back onto the path of progress and prosperity following the ravages of the pandemic.
The president also disclosed majority of persons contracting the virus have been found to have ignored the COVID-19 safety protocols and said security personnel are being deployed across the country to enforce compliance.
Again, according to statistics from the Ghana Health Service, the considerable number of persons who are severely ill are surprisingly relatively youthful persons with no previous underlying health conditions. The number of confirmed deaths has increased sadly from 338 persons to 352 within the period. It is my duty to protect lives and livelihoods. In furtherance of this, I've instructed the Inspector General of Police to direct officers, men and women of the police service to ensure the rigorous enforcement of the law on mask wearing at all public places and in public transport. They're also to ensure the closure of all nightclubs, pubs, cinemas and beaches that may be operating in defiance of the law. They will be assisted by the other security agencies if need be. Persons in marketplaces, workplaces, and operators of public transport must conduct their activities in accordance with the hygiene and safety protocols. The wearing of masks in these places is mandatory. Regulatory agencies will undertake random checks to ensure conformity with COVID-19 rules. Should any facility or institution fail to comply with these directives, its activities will be immediately prohibited and appropriate sanctions applied. It is important that I remind all Ghanaians that severe punishments exist on our statute books for persons breaking the law on the mandatory wearing of masks.
He also disclosed that Ghana has recorded cases of the new strain of COVID-19.
Recent genomic sequencing undertaken by our scientists have established that some arriving passengers tested positive for new variants of COVID-19. These passengers have all been isolated. Furthermore, work is ongoing to determine the presence and extent of spread of the new variants in the general population.
The president also said as part of the reopening of schools on Monday, government is undertaking measures to ensure children are safe.
Our children in kindergarten, primary, junior high school, SHS2 and SHS3 resume school from tomorrow. I wish to reiterate the government has taken the required steps to ensure their safety in school. Heads of institutions, as well as their teachers, have undergone the requisite orientation on guidelines for school reopening during COVID-19 to enable them assist with compliance of students with the protocol. As we take these big steps to go back to school, Your attitude, your behavior, your self-discipline will decide whether or not our schools will remain open. I'm pleading with you. Please observe the COVID-19 protocols at all times. You must maintain the level of discipline and sense of responsibility to stop the virus from spreading in your schools and for those students at home as well.
That was President Akufo-Addo last night announcing that there are new variants, and so government intends to take a more stricter position on ensuring that we all wear the masks. Well, while the police prepares for the deployment, there is total disregard for the protocols across the country. In the Central Business District of Accra, not many have respected the protocols. This afternoon, we checked from the regions on how these protocols are being observed and rolled out even. We start from the Volta region. Director of Health, Dr. Senanu Jokoto, is joining me via Zoom. Hello, Doc. Good afternoon.
Listeners, but let me make this quick correction. I'm the Deputy Director of Health.
Right.
In charge of public health, and I'm speaking on behalf of my Regional Director of Health Services, who is Dr. Timothy Lecture.
Very well. Thank you very much for that correction. Let's find out how the Volta region is looking like in terms of your case management. How many do you have so far?
At present, we have 37 cases.
Okay.
And if you compare it to 2 or 3 weeks ago, where we had 0 cases in most instances, then you can actually say that in comparison to the national picture, it is very similar. We have seen an upsurge of COVID-19 cases in the past 2 weeks. To move from 0 to 37 is quite significant. And in the last week as well, we have also lost 1 patient due to COVID-19. And you would have noticed that in the past 12 months, we have had 12 mortalities. So if within a week we have lost a patient in this current upsurge, then that also is cause for concern.
We understand that this happens to be the very first death recorded in the region, but we need to clarify this. How sure are we that it is?
During this particular surge, this is the first mortality that we have recorded.
As in this particular one
in the past 2 weeks.
All right.
But we have a total of 12 mortalities since we recorded our first case on the 12th of April.
Okay, so if you put all together, you have about 12 mortalities since it started in March, and since you recorded yours in April. But in the past 2 weeks that the cases have surged from 0 to 37, this is the very first death.
This is the first mortality. So in total, the Volta region has 13 mortalities now.
How is the outlook as we speak? Yesterday, President Akufo-Addo spoke about enforcing strictly the wearing of masks. The last time I spoke to our correspondent in the region, people were simply disregarding that rule. Has the president's announcement last night changed anything from your perspective?
The president's announcement last night has given us the required impetus. Race communication is something that has been ongoing, but usually when they hear it from a higher source, they tend to wake up. Okay. So this morning, what has dominated the airwaves has been adherence to protocol, and it has really helped. And it has trickled down. Obviously, we take a cue from headquarters. The instructions they've given have trickled down all the way to the districts. So you'd notice that, for example, at the region, we've had our Regional Emergency Operations Center meeting on how to re-strategize so that we actually respond appropriately to this COVID-19 pandemic. Also, we are meeting our stakeholders via the Regional Public Health Emergency Management Committee very soon. I'm sure it's by tomorrow. I know the invitations are already going out. There we have the police, we have the immigration, we have all the security agencies and all our partners who are required, Ghana Education Service, so that they are able to put in strategies to be able to overcome this particular challenge. Also, we are looking at the instance where the citizens themselves would notice that it is their own responsibility to ensure that they stay alive, so that they would actually begin adhering to protocols even before enforcement comes in from the police. So yes, the president's announcement yesterday has renewed the energy to fight COVID-19 as we speak in the Volta region.
Regarding the reopening of schools, what has your outfit observed, and what plan do you have to correct? And I'm saying correct because I assume that it hasn't been the best. It hasn't been up to expectation. The children going back to school. So, what are the steps your outfit is taking to correct what we're all seeing as still disregard for the protocols?
We have been tested in this regard. If you may recollect, a number of months ago, secondary schools were reopened for the final years to come and write the exams. SS2 also came in to write the exams. Universities have also come in and written their final exams. So during that process, we collaborated very well with the Ghana Education Service, and we put in place all the required mechanisms to ensure that all the students are safe. So this is on a larger scale. What we have done is to also reactivate the district task force that is monitoring all the schools to ensure that everybody is adhering to the protocols. So there are monitoring teams that have gone out today to see exactly what the schools are up to. But prior to that, we had mapped out all the schools and linked them to facilities so that if the need arises for them to receive care, they will do so and get the care promptly.
All right, Doc, I'll say a very big thanks to you. This is a conversation I will continue to have, seeing as we have just started going back to school. I'm sure we'll be dealing with the matters that arise. Dr. Senanu Jokoto there is the Deputy Director of Health in charge of public health in the Volta region there, helping us with the situation there. I'm taking you now to the Central Business District here in Accra, where not many have respect for the protocols. Kweku Asante was in town today to observe. He's joining me via Zoom with what he found. Kweku, what did you see?
Right, so in Accra Central today, you see a number of people going about their normal duties in town without the face covering and without the requisite other face shield or the mask and all. And so most of them were not paying much attention to these protocols that the president has outlined. And yesterday in the president's speech, he said a lot of things about ensuring that there's compliance to all these and the directives. And so there was none of that in town today. And one curious thing is,
speaking of which, Kweku,
of the Accra Business District, and there were very little policemen in town, or you will not see policemen going about trying to check these people whether or not they are observing these protocols. And so that was one bit of a surprising thing for me, right around the AMA to Tema Station, right into the to-do part, closely even to the Greater Accra region office of the police, and there are very little policemen inside trying to enforce these protocols.
Did you get a chance to interact with any of them to figure out whether or not they heard President Akufo-Addo and what they make of what he said vis-a-vis their behavior this morning?
Right, so towards the Accra Polytechnic, the Accra Technical University entrance, I spoke with some students, and that school has just reopened, and a number of them were undertaking their registration to be able to start their academic year. And I spoke with a few of them, and some of them had either not listened to the president, some of them had said they had heard what the president had said, but they probably were just not interested in putting on the mask. Most of them, if not all, did not have any reasons for which reason they were not wearing the mask or at least any face shield. They were just going about their normal duties without the mask. And you could see that there's a little bit of fatigue with the people in terms of how they will comply with the protective measures that have been outlined by government, and to which yesterday the president spoke and said that we'll be expecting that the members of the Ghana Police Service will be deployed to enforce this rule.
Kweku, thank you very much. Kweku Asante there, he was out and about today, checking for us whether or not the president's words have changed people's attitude. Early days yet, I would say. We'll see how it goes as we go along. But let me bring you back a story that we aired last week. Our head of health desk here, Fred Smith, was in town to find out what will get people to comply with the protocols. Here is what he found.
On the streets of Accra and other cities across the country, many are going about their normal activities without face covering. The few who have masks are either keeping them in their bags, pockets, or not wearing them properly. Some, like this woman, attribute this to the bad example showed by the country's political leaders on national TV. In March 2020, when President Akufo-Addo imposed a lockdown in Greater Accra, Kumasi and contiguous districts, compliance to COVID-19 protocols was high. Police officers would routinely stop and question those not in masks, whilst authorities deployed task forces to the central business districts to ensure compliance of the no mask, no entry policy. At this time, the country's case count was just 141 with 5 deaths. Today, there are more than 55,000 confirmed cases, 1,200 of them active, 44 severe and 338 deaths. But this is when Ghanaians are being reckless about the disease. Several weeks of electioneering campaigns, Christmas and New Year celebrations have contributed to the rising cases.
I would say 10 days ago that we started having slightly higher cases than discharges. So if you have more cases than discharges, then it tells you that you are going to have an increase in active cases. So I would say that over the past 1 week, there's an increase in number of cases. Government
is already procuring vaccines, but this will not be enough to vaccinate everyone and won't even arrive until at least March 2021. The Ghana Medical Association has confirmed the country's treatment facilities are stretched following an increase in symptomatic cases.
As a country, gradually, we are going to slip as far as COVID-19 is concerned. The situation is that, one, enforcement is not happening at any levels whatsoever. Over the Christmas period till now, I have had calls from over 20 different families who have had COVID one way or the other. And some of them, you talk to them, the system has not even reached out to them to see whether, one, they are doing well or what is happening to them in the first place. Okay. And these are people, per the structure we are running, are supposed to be known to the system. They are doctors or healthcare professionals who will be mapped to these patients to oversee their care, even where they are receiving care at home, i.e. outside the care centers or the hospitals.
Some Ghanaians we spoke to want security personnel deployed to enforce the protocols.
Well, security agents are around, so they should be around to make sure that others are wearing it. I was not wearing the mask and I went to pass in front of the Ghana police headquarters. Okay. But when I saw the policeman standing there, I wore it. Okay, so as you said, the security agencies, if for instance, let's say as we were coming inside, there's a policeman over there ensuring that people wear their nose mask. My brother was not wearing it, unfortunately. So like you'll be told to wear it even before he enters this place. So as you said, I think that's what is best to be done.
When it started, they actually said that the police should be the ones enforcing the wearing of nose masks. Now they don't also care. They don't wear it first of all, and they don't also even care.
With new variants spreading like wildfire, everyone would have to take personal responsibility before the security agencies are deployed to compel us. Fred Smith for JoyNews.
And that was a report we put together last week. You can tell the story is not very different. If you flip the script, it looks pretty much like it was done today. Well, I take you to the Central Region where Dr. Godfrey Sapong, who is the Deputy Central Regional Director of Health, has been speaking to our correspondent, Richard Kujonyako, on compliance levels there.
Currently, in the Central Region, we have 2,000, cumulatively, we have 2,212 cases. And this is taking it from the 8th of April when we first had our first case to date, 2,212. And our active case count currently is at 47. Majority of them, I think about 36 are in home management and 11 are in our treatment centers.
How well are these people that are in the treatment centers doing? Are their conditions critical? Or?
Well, majority of them are in moderate, they are moderately ill. I think about 3 of them are critical. 3 or 4 are critical. The thinking you get and the impression you form when you walk through town, you go to the supermarkets, you go to our beaches, you go to the bars, go to churches, sit in our public transport system, is that COVID is no more, And sometimes you hear this from really people who should not be talking the way they're talking. Now, for some reason in Ghana, the disease doesn't kill, and that is just a common cold. And some even go to the extent of saying that, it's a horse and that, we should just go back to our lives, and forget about this face mask and the rest of it. And I think that's quite unfortunate. It appears that we've all gone to sleep, as far as the compliance with COVID-19 protocols are concerned. And that's quite disturbing, really disturbing.
The schools have reopened.
The schools also have COVID teams. All schools are enjoined to have COVID teams made up of management and the student body to ensure that on the school campuses and the compounds, COVID-19 safety protocols are observed. And then the schools also have infirmaries and sick bays. We've tasked the nurses working in the sick bays and the school infirmary. So work with the school COVID teams and the school management to ensure that we communicate correctly on the risk of contracting COVID-19, the symptoms, and what to do should you suspect you have COVID-19 while you are on campus or you are in your house. And we are also reaching out to guardians to be on the lookout. Watch your wards and watch your children when they come home. Ask about the symptoms, ask about how they're feeling, and should you suspect it, also know where to go. Go to the appropriate health facilities and ensure that you report it, and then we take it from there.
There are some parents, finally. So there are some who, when you meet them, I don't have, and all of that, in spite of the fact that this is just one city or something. Do you have?
Richard, let's face it, people are not used to wearing a face mask, and they give all sort of reasons. It's uncomfortable wearing the face mask consistently wherever you go. It's uncomfortable talking through the face mask. Sometimes you need some fresh air to breathe, as if when you're wearing a face mask, you don't breathe air. It's not something I think traditionally we are used to, until COVID came in. And what is making the situation worse is that, yes, we started so well, getting periodic updates on COVID. The media space was ablaze with education, and information on updates of COVID. But I think that somewhere along the line we all went to sleep. We spiraled downwards, and it affected the compliance with the safety protocols. It's something that we have to deliberately, consciously, make an effort to do regularly. And I think that this is where the education should go. And the teaching staff, as well as management, ensure that COVID-19 safety protocols are enforced, they are taught to students, they are encouraged in all classrooms and halls.